5 at the top, it shows you a picture of the microhematocrit. All right, on to erythrocyte indices. So red blood cell indices means the exact same thing. These differentiate the type of anemia present by indicating the size of the red blood cells and the concentration. So we're further testing to see more about this anemia. What type is it? What's it caused by? Okay, ESR on the next page stands for erythrocyte sedimentation rate, ESR. So also called the SED rate, evaluates red blood cells. It determines the rate they settle to the bottom of the tube, so it's like timed. They're going to time how long it takes for the red blood cells to settle to the bottom of the tube. I do want you to know we use the Wintrobe method. The Wintrobe method is how we get your ESR. In the second column now, so a big value or an increased value can suggest inflammation, injury, illnesses, arthritis, inflammatory bowel disease. These sorts of things can cause that. And it also can be elevated if the patient is menstruating. Important to know if they're menstruating, it can be elevated, and pregnancy. All right, white blood cells next. So they have a shorter lifespan than red blood cells. They don't live as long, and they're produced in the bone marrow. Their function is to defend against infection. We talked about that a little bit already. They are important for your immune system. So they go around and they fight the infection, and they go around and eat, basically, the germs. Let's see, the range of white blood cells in an adult is 4.5 to 11,000. Let's go on to differential white blood cell in the second column on the next page. So white blood cell count, or DIF, determines the percentages of each type of leukocyte in each sample. So with DIF, you'll probably hear of that a lot. They order these tests with DIF a lot. On to the next page, it gives you a picture of the types of white blood cells and the different ones. And now we're going to jump into neutrophils in the second column. So neutrophils act as the body's primary defense and make up the largest percent of your white blood cells. So your biggest portion is the neutrophils. So primary defense, and we have the most of those. Phagocytosis is where the neutrophil surrounds, swallows, and digests the bacteria. So kind of like I just said, it goes around and eats it or drinks it, basically. All right, eosinophils on the next page now. So these are produced in the bone marrow, and a detection of a large number of these can indicate parasites or certain allergic conditions. All right, basophils. These are produced in the bone marrow, and they produce heparin. And important to know about heparin, heparin is a substance that prevents clotting. So important to know about heparin, prevents clotting, produced by basophils. When an individual has a condition that's creating inflammation, heparin can assist in preventing the occurrence of clotting. All right, lymphocytes, white blood cells produced in the bone marrow and in the lymphoid tissue like the spleen, producing antibodies and foreign substances, producing antibodies to fight against foreign substances, So lymphocytes, these have the big job of fighting your foreign substances like bacteria, viruses, pollen. All right, monocytes is next, white blood cells formed in the bone marrow. These assist in phagocytosis, so they are like the assisters. All right, platelets, also called thrombocytes, again, the smallest cells found in the blood, formed in the bone marrow. They live for about 10 days. The function is to assist in the clotting of blood. We already kind of mentioned that before. Let's jump on to PT-INR, prothrombin time, PT. INR stands for International Normalized Ratio. Important to know about this test. This is a really commonly done test. Coagulation test that measures the amount of time it takes for the blood to clot, basically. And INR is a standard tool. Everything is standardized across the board, allows specimens to be performed at different places, but we still get the same consistent results, so that no one is saying, well, we thought it was normal, and well, we thought it wasn't normal over here. So everyone, international normal ratio. All right, so this test determines if they need to adjust the anticoagulant therapy. So if they're on blood thinners like Coumadin, it's really important that they come in and have their PT-INR testing done to make sure their blood isn't too thick or too thin, because that would be an emergency and we might need to adjust the dose. On to the next page. We'll go on to other blood tests and start with CMP. Stands for Comprehensive Metabolic Panel, CMP. Screening tool used to evaluate organ function, check for disorders, and monitor conditions and meds. About 14 essential tests: basic metabolic panel, renal panel, liver function tests, and electrolytes, what it's looking for. Onto the next page now in the second column. An abnormality in any of these areas can mean we need further testing. And that's true for almost everything in healthcare. If we find it abnormal, we always want more testing. It's recommended you need to know that the patient fasts for 12 hours before this test. 12 hours. Before we move on from this page, table 47.2 has a lot of important things in there. It would be good to know table 47.2. You may consider even making flashcards in table 47.2. All right, we'll jump to the next page. And we're going to go on to diabetic tests on page 1176 in the second column. Diabetic test. All right, so diabetes, we've already talked about and heard about this many times in the program. Evaluated, manage it, and managed through blood. Diabetics monitor their blood sugar with a glucometer. And then we often do a hemoglobin A1C. You've probably heard of that. Glycosylated hemoglobin, or we call it hemoglobin A1C. This is going to test your long-term control of diabetes. So this isn't like a test of what their blood sugar is right now. It gives them a result of what it's been average for the last 3 months or so. All right, because red blood cells live for 3 to 4 months, they have glucose and absorb it over time. Glucose binds with the hemoglobin, and with the A1C, the percentage of glucose in the cells is measured to reveal the patient's plasma over a 3-month period around there. You should know, important to know, the typical result for a non-diabetic adult is 3.5 to 6% for your hemoglobin A1C. Okay, PKU testing, phenylketonuria, so a congenital disease caused by a defect in the metabolism of the amino acid phenylalanine. The unmetabolized protein accumulates in the blood, and if it's untreated, can result in mental retardation. This is performed in newborns. You've probably heard of PKU testing before. Mono testing, mononucleosis. So this is how we determine if a patient has mono, is with the mono test. It's also called the kissing disease. You've probably heard of that before as well. Very contagious, easily spread. Onto the next page, more about mono testing. So this is going to be done a capillary stick, just a little bit of blood, finger stick, so capillary puncture. We order it when the person has symptoms like fever, headaches, swollen glands, that sort of thing, and it's just a quick capillary stick. Patients with negative mono tests and have few symptoms, they could still have it. If the infection is still there, it would be really important that they maybe had a repeat test. And that is the last thing in this chapter. Your EOCs that we always recommend you do are on page 1180. And you can let me know if you have any questions about what I've covered. Sorry you can't ask them in person, but You can always call MTI or reach out through email if you have any questions. And I hope that you do good on your test. Have a good one.